A very warm welcome to The Bigger Picture, the World Economic Forum's webinar series in which we explore some of the big trends that are affecting businesses, governments, and society. My name is Stefan Mergenthaler, and I'm speaking to you from our headquarters in Geneva. Thank you very much for joining this important discussion today on the coronavirus and rapid response healthcare. There are obviously a lot of opinions on the implications, on the response, but today we have the opportunity to discuss the dynamics of this outbreak with one of the leading experts in the world on disease and emergency analytics. It's a great pleasure to introduce Professor Neil Ferguson, Director of the Institute for Disease and Emergency Analytics at Imperial College London. Neil, thank you for joining us. Thank you very much at this important moment.
It's a pleasure to be here.
I'm also joined here in Geneva by my colleague Ryan Morhard, who leads the forum's efforts on global health security. He is currently working closely with WHO on the response of the outbreak, and I'll bring him in a little bit later as we move into the discussion. Let me just briefly explain the proceedings for the next 30 minutes or so that we have together. We will start with a short presentation by Professor Ferguson, and then we'll be opening up this discussion to all of you. You can submit questions at any time by using the Q&A window on your screens. We already received some of them ahead of the session, and we'll try to bring in as many of those as possible, but please help us by being concise and to the point as you submit them. And we may also group them just for the sake of maximizing the time that we can spend on the answers. So with that, Professor Ferguson, the floor is yours.
Thank you. I'm going to quickly go through just some introductory slides and mainly talk about the coronavirus outbreak. So I head something called the MRC Center for Global Infectious Disease Analysis at Imperial. We're part of a larger institute called JID, the Abdul, Latif, Jameel Institute for Disease and Emergency Analytics. And we work in a number of areas, but most relevant today is our application of data analytics to respond to health emergencies, which builds on about 25 years of experience in handling outbreaks. And so what we're about is understanding and interpreting patterns in data, and particularly in infectious disease outbreak data, to inform policy. And guided in that by our deep understanding and collaboration with clinicians and scientists around the world. So we're connected to many of the major players in terms of health policy globally, routinely across many infectious diseases. I personally advise the World Health Organization, UK government, and several other governments around the world. The coronavirus is to come to the topic, as I'm sure you're probably all aware by now, actually a broad family of viruses. There are several viruses endemic in the human population, and they're called mild disease, cold-like symptoms. However, back in 2002-03, we became aware that there were animal coronaviruses which could infect humans and indeed cause severe disease, and that was the outbreak of so-called SARS in China and then Hong Kong and around the world. Perhaps a little less well known is another variant on the same family of viruses, also causing severe disease, MERS, Middle Eastern Respiratory Syndrome, which also has quite a high case fatality. MERS, however, appears to be rather less transmissible than SARS was. Now, of course, we've encountered a third animal coronavirus, different from both of those, so genetically most related to SARS. And unlike in SARS, we heard about this virus really quite early. On 7th of January, a cluster of pneumonia cases had been identified earlier, and the new virus was identified. Just to put that into context, we now think probably transmission was ongoing in Wuhan from about the beginning of December, from the earliest onset dates we see. And from that time, really from 7th of January, events have moved very quickly. Initial case numbers in China were very low, but then 30th of January, the case was confirmed in Thailand, and then another in Japan, which made ourselves and others realize that really the epidemic must be much larger than was reported in China at that time. Only 41 cases were reported. Since then, things have accelerated. We're now up to over 70,000 cases at the current time. The epidemic in China has been until quite recently doubling every 4 to 5 days in size. And we've had cases in some 30 countries worldwide, some evidence of sustained transmission in at least Japan now. So our role in looking at this has been to ask some basic questions which are relevant policy. Really, how fast is the epidemic spreading? How far has it got? You know, how bad is it in terms of, you know, what's the risk to human health and what can we do about it? And unlike normal academic pursuits, we've been, as with many other groups, putting out reports on our findings basically immediately rather than waiting for peer-reviewed publications. So initially, so based on that observation that there had been 3 exported cases by 12th of January this year, and yet only 41 cases reported in China, we went and asked the question, given what we know about number of air passengers per day from Wuhan, can we say anything from that travel volume about how many cases there really must be in Wuhan to have generated 3 exports? And we worked out that basically there was about a 1 in 600 chance that, you know, somebody in an incubation period or just after of disease might travel internationally, and therefore multiplying 3 by that 600, well, we actually came up with an estimate of about 1,700 cases. Since then, we've updated that analysis based on really an accelerating trajectory of international cases. So initially, an update saying there must have been 4,000 cases by the 18th of January, and now soon to be released, but consistent with other people's estimates based on more sophisticated methods, we think there must have been probably 107,000 cases by the 3rd of February. Some of that is down to epidemic growth, but some is just down to refining the methods and having more data available. All of this indicates, if you compare it with official case numbers, that the outbreak has been substantially underreported, or under-ascertained maybe is the right word, by more than tenfold. It looks like surveillance in Wuhan in particular has been prioritizing the diagnosis and testing of the most severe cases clinically. That also explains, as we'll see in a moment, the apparently high case fatality ratio seen there. Based on more detailed data made available by China and from a variety of sources, so-called line list data, which gives you the trajectory of cases over time, not just by date of report, which is quite biased, but by when those cases develop disease. You can see the epidemic curve in more detail, and this gives an example. Actually, this is now going back a few weeks of data, sort of data which was available over time. The drop you see after the 22nd of January in this plot is not real. It's just down to so-called censoring. In fact, we only had observations made up to the 26th of January, and there's a reporting delay. You can analyze these data to calculate something rather critical in epidemiology, something called the reproduction number, which is a measure of transmissibility. It asks the question, how many cases is one case causing over time? What's the amplification factor of the epidemic? If it's greater than 1, then we have a growing epidemic. If it's less than 1, the epidemic is declining. It also tells you a lot about the sort of intensity of control efforts required to control spread. And what we found is, I mean, with a lot of statistical noise, is for this virus, we think the reproduction number in the absence of controls is somewhere in the range of about 2 to 3. Occasionally less, but you'll see on that graph, the blue curve occasionally goes even above 3. That's probably down to reporting biases, but the central estimates are between 2 and 3 now. So that transmissibility put into context, I should say, makes it as not more transmissible than pandemic influenza viruses, which typically have a reproduction number of about 2. The second important question is really how severe is this virus? And again, if you just look at official case numbers from China, you will get one value, but there's an additional challenge in estimating the case fatality ratio, and that is there's a long delay from when somebody develops symptoms to when they eventually die. Case in point is the death reported in France just over the weekend was somebody who probably had been infected a month earlier. So when you look at the deaths today, then in some senses you should be comparing them with the cases that were reported, up to about 2 to 3 weeks ago. So the ratio you get by just dividing official case numbers of deaths divided by official case numbers of all cases is the minimum bound really on what the true case fatality ratio is, the true proportion of cases which will eventually die. And so we adjust for that in a variety of ways. And the pyramid shown here is typical in infectious diseases. Surveillance systems have different levels of sensitivity, and they typically pick up the most severe cases. And so we think, particularly in Wuhan, really, the cases being picked up were pneumonia, often severe pneumonia, a few cases with milder symptoms, but not many. Cases detected internationally picked up a much wider range of symptoms, but still people were largely asymptomatic, symptomatic, had fever, runny nose, sore throat. But underneath that, there's probably a lot of very mild cases or people who even truly have no symptoms at all. And so what we'd like to be able to do is estimate really what proportion of everybody getting infected will die, because that will determine the global public health impact of this virus. So we kind of estimated in each of those tiers, first of all, within Hubei province, particularly within Wuhan, a really quite high case fatality ratio of about 18%, reflecting the fact that most cases there were old and had pneumonia. Then in travelers, people detected outside China, we now, I should say, have well over 300 and like 400 international cases and 5 deaths. But the case fatality, because again, that problem of the delay, we still estimate the case fatality ratio in travelers. Depends on the method you use, and these numbers are constantly changing, but our best guess at the moment is somewhere between about 2 and 4%. And then we have to do the final leap, which is to all infections, and we really have very limited data for that. We just really have one data point. There were about 5 or 6 repatriation flights countries put on to take their citizens out of Wuhan, really at the end of January, early February, and bring them back. And a number of those countries swabbed absolutely everybody on the plane. So we have a measure of what proportion of people in Wuhan at the end of January were infected from that. And that allows us to do that final leap, which is to really say that probably international surveillance has, well, there are probably 3 times more cases than international surveillance might indicate. So we take that 2 to 3% figure from travelers and divide it by another factor of 2 to 3. And so we end up with this about 1% fatality ratio. To put that into context, that is rather worse than either the 1957 or 68 flu pandemic, and maybe slightly better, or maybe comparable at least with the 1918 influenza pandemic. There is a lot of uncertainty around those numbers, as you'll see from the ranges at the moment, and in coming days and weeks, ourselves and other groups around the world are working hard to try and refine those estimates as more data becomes available. Finally, I mean, that risk is not applicable to everyone. So the distribution of cases in China is skewed by age somewhat in terms of the relative risk by age, and that reflects the sensitivity of the Chinese surveillance system being highest for severe cases and older people having more severe disease. And then, but deaths, that biasing towards older people is even more apparent. So that the risk of death in those over 60 basically is much, much higher than those under 60 apparently, and really is concentrated in the oldest age groups overall. So for most people under the age of 60, I mean, they're likely to experience a relatively mild respiratory disease. There are instances of death in that age group, and those typically in people with existing health conditions. And I'd recommend people, I mean, if people want more details, China CDC published a very informative, detailed report yesterday of the breakdown of the whole epidemic till date, but also breakdown of deaths by age and by comorbidities. So we think, in terms of what we can conclude from the data so far, it's apparent that Wuhan is just past the peak, really, of a very large epidemic of novel coronavirus. The rest of China, growth is slowing, probably about a month behind. One thing we're trying to assess, it's quite difficult, is the effect of the very draconian controls in place in China. The travel restrictions probably slowed spread nationally, but in and of themselves do not really limit transmission from person to person. Probably a much bigger impact has been made by basically the extension of the Spring Festival and the closure of schools and workplaces for an extended period, and restrictions on people even leaving their homes. That probably has also certainly had a drastic impact on contact rates between people across the country, and probably slowed transmission substantially in the last few weeks, and explains, I think, to some extent, the drop in case numbers. Some case number drop was expected in Wuhan anyhow, because the epidemic probably was near its natural peak. The key question at the moment is what will happen as contacts resume, between people resume in China. I mean, as the economy restarts, people go back to work, back to school, then we might expect transmission to resume to some extent. What we know, and overall, I should say, this virus is going to be very difficult to control internationally. I mean, with most cases being relatively mild, with some transmission occurring before symptoms, short of imposing the sort of absolutely draconian controls that China has done, it will be very difficult for other countries to achieve the level of control seen there. We think the virus is as transmissible as a pandemic influenza virus, and therefore the rate of spread globally we've seen so far is not unsurprising. The severity, the case fatality ratio is still uncertain, but is certainly within the range of 20th century influenza pandemics. And certainly, speaking myself in the UK, I mean, and many countries are currently focusing on slowing entry of the virus into the country and the establishment of local transmission, really to buy time for the development of countermeasures and health system preparedness. I'll stop there. Thank you.
Brilliant. Thank you very much for this overview. And now, as we enter into the discussions, we already receive quite a few questions. Let me remind you, if you still want to ask a question, use the Q&A window on your screen. But maybe to start us off, let me turn to my colleague Ryan Morhard for first question from us at the World Economic Forum.
Yeah, sure. Thank you, Stefan, and thank you especially, Professor, for the briefing. And I guess if I could ask, one thing that we have been doing, and Stefan mentioned in the beginning, is for now several weeks we've been working with WHO and with partners, several of whom I think are probably on the line, across several different areas of work on supply chain, on travel and tourism, on communications, and so on. And one of the questions that we keep hearing from that group, and I suspect is also shared with those on the line now, is, the question is, what are the dimensions or variables where the curve of this outbreak we might be able to bend that curve? And I know you mentioned that this will be an outbreak that is difficult to control internationally, but is there areas where you see a role for business to mitigate a risk and impact along those dimensions that might bend the curve? So your thoughts in that regard are very much welcome, Professor.
So yeah, so I think first of all, we have limited actual data on the effect of interventions. We're observing what happens in China, but they've tried a huge number of things at the same time. But based on experience from influenza, and I should say influenza transmission rates have dropped a lot in Hong Kong and China. So clearly the impacts have been great across respiratory diseases. The key things which I think are relevant to business is really around minimizing contact between people. So things like enabling home working, minimizing travel, those sort of things are likely to have the biggest effect. We just can't say right at the moment exactly how much effect they'll have.
Great, thank you. There's another question that has come in was maybe asking you if you could expand a little bit on the point you made, that the rest of China is still a month behind in terms of the outbreak, the dynamics. what exactly does that mean for China and the rest of the world? If you could expand on that.
Yeah, so the epicenter was definitely Wuhan, and transmission started there and then got seeded across the whole of China. So by a month behind, I mean, they saw Wuhan has had a month more transmission than most other cities in China. It takes the epidemic a certain time to get to a scale in Wuhan before you expect to see cases exported. Just you need quite a number of cases. So now the picture of what's happening in the rest of China is confused at the moment. Official case numbers are declining, but there are limits in testing capacity, and most testing is of suspect cases who have a link to Wuhan or have a link to Hubei province. So we don't know how much testing is going on of people who just normal respiratory disease or people with pneumonia in hospitals. So if chains of transmission are really ongoing, which haven't been recognized, we don't know about them by definition. But almost certainly the measures in place across China had some impact on transmission. The key question is that, I mean, they're not sustainable even for China for an extended period. So as they are lifted and we have people going out in the streets again, going to work, going to school, the extent to which transmission will bounce back is unclear. I mean, it's quite likely to some degree. But at the moment, we're just going to have to wait and see what happens.
Brilliant, thank you. There's another question came in about your assessment of the situation in Singapore, and specifically sort of looking at the dynamics there and what it means for the rest of the world. Might you be able to comment on that?
Yeah, so I think there are two countries with very good surveillance systems who've been doing their best to track the epidemic where things are looking concerning. And Singapore is one, and I think they have done probably more than any other country to really track chains of transmission in imported cases. But even there is some indication there may be unrecognized links in those chains. And whilst it's too early to say that, to be sure that community transmission has started at a large scale, then it certainly is looking worrying there. The other country is Japan, where there are multiple clusters of recognized cases, not all with links to other chains of transmission, and it looks like Japan may be on the verge of quite large scale community transmission. Again, I mean, Singapore may have a history of being very successful at containing infectious disease spread. They may get on top of it. I think Japan, it's a much larger population over a much wider geographic area, will have many more difficulties despite their best efforts.
Great, thank you. There's a lot of questions coming in because we have a lot of participants from the business sector who are thinking about sort of their preparedness, and questions focusing on, you talked about the control efforts to control the spread, but one point that has come up repeatedly in the questions: are there any alternatives that you see to severe restrictions in international travel? What would you say about that?
So I think we're in a containment phase at the moment, both in individual countries and internationally. And during that phase, it obviously tries to make it's sensible to try and limit spread of infection from one area to another. If, on the other hand, well, if in the next few weeks what we see is a pattern of local epidemics in individual countries taking off, at that point we'll be moving into what's called a mitigation phase of trying to minimize the consequences. At that point, it will be of less utility to maintain restrictions on travel. If the epidemic and the virus is so widely disseminated, then further restricting travel will have no point. And the countries I'm aware of are planning that, and it's quite likely travel restrictions will be dropped at that point.
Great, thank you. Another set of questions is focused on the effects on health systems in various parts of the world, and the degree of preparedness and implications for health policy and health systems in general.
Yeah. So it's a big if at the moment, but in my view, we should be preparing for it. If we see large-scale epidemics in other countries, for instance, the United Kingdom, then without doubt, health systems, even in you know, rich northern countries, will be severely stressed. I mean, the sort of levels of respiratory pneumonia will be well above baseline levels we expected due to seasonal flu, maybe 3-4 times higher, maybe more. And not only are people quite sick, they're probably sick for quite a long time, so they occupy beds for weeks. And so there will be need for difficult decision-making, triage, cancelling of elective surgery in most countries. I mean, most countries are in the phase of that plan at the moment. I think in low and middle income countries, clearly there's less capacity in the healthcare system, and the effects will be worse. So yes, it is a major concern at the current time.
Great. Let me pick another question that came up. You, as someone that models a disease outbreak, what would you say from your experience, from your models? What would you say is the most counterintuitive measure to control disease outbreaks? People have lots of opinions about that, but from your perspective, what would be the most counterintuitive measure?
Well, I'm not sure if counterintuitive is the right word in this context. I mean, I think there are measures which can have unexpected negative consequences and really do more harm than good. I think this virus behaves, a lot like many other respiratory viruses. So measures to reduce contact are to be recommended. I think we're still evaluating, and it's unclear how important children are in transmission. A perhaps slightly counterintuitive thing is that children are very underrepresented in cases at the moment, and yet typically in respiratory disease epidemics are the drivers of transmission. And so it may be in this context, people often, for flu pandemics, for instance, use school closure, deliberate school closure to reduce transmission. That may be less effective in this case. That's not so much highlighting a control measure which works, but highlighting a control measure where you often rely on, which may be less effective. But really, so many things have been tried in China at the same time. It is quite difficult to disentangle what worked and what didn't.
Very, very interesting. Thank you. And then maybe let me pick a final point from the questions, really around the timeline for medical treatment of this. What's your expectation there, and how might that affect the models you have for the trajectory of the outbreak?
So almost certainly treatment of severe, we're talking about treatment of severe cases here. I mean, ones which actually require treatment. Most people will have mild illness and doesn't require treatment. But for the severe ones, there's a lot of research underway on how to improve case survival. There are trials underway in China of the use of a number of classes of drugs, but particularly the protease inhibitors, HIV drugs effectively. Those are looking quite promising at the current time. And I think if used in a timely manner, may reduce mortality, but data is yet to appear. None of these things will affect transmission, though. By the time somebody gets to hospital with severe disease, but those people account probably for a very small amount of overall transmission.
Great. Thank you very much, Professor, for this thorough briefing. I'm afraid that's all we have time for today. We'll obviously continue to monitor developments there. I should say also, if any of the participants would like to follow up with any of the work presented both by Imperial College, but also of the World Economic Forum, please do send us a note. Also, make sure you visit intelligence.weforum.org. That's really where you can access all the latest insight and analysis from our various expert communities, partners, and activities around the world. We hope you found today's session informative. Please do send us your feedback, your ideas, and suggestions. For now, let me thank again Professor Niall Ferguson for taking the time at this moment. And please join us next time. Thank you.
Thank you.